Maine is the oldest state in the nation. Roughly 82% of all deaths related to COVID have occurred among people 70 years of age and older, and Maine is the oldest state in the nation. So roughly 55% of all deaths in Maine due to COVID have occurred among residents of long-term care facilities. Maine led the nation in the infection rate among nursing home residents from March through April of 2021, and we're roughly 30% higher than the second highest state. Since January, Maine's nursing home operators have made it clear that they are in a dire situation, and their funding and staffing issues have reached crisis levels. 45% of Maine nursing homes just reported a staffing shortage. LD 1573 would help fund these issues, but even if it passes, it does not take effect until January of 2022. That'll be too late for these residents of the nursing homes, and likely a number of these facilities will close. We must have funding begin in July of 2021. I'd like to introduce Senator Paul Davis, who serves as our lead on the Appropriations Committee, to talk about the current funding situation. Senator Davis.
Just give him a second. Hey, be nice to me.
Why?
It's because you're older than me. Yes.
Well, good morning. My name is Paul Davis, and I have the privilege of representing Senate District 4, which is all of Piscataquis County, parts of Somerset and Penobscot. And I can tell you the travel biting up to Piscataquis County. I've served in this building for quite a while. I've been both in the Senate and the House. I've been in leadership, and all the time I've been here, I've never seen as much money is available to the legislature as there is this year. Between the federal stimulus, the state surpluses, we've had more than $2 billion come in. What's more, the revenue forecasts show that the revenue growth of 3% to 4.5% in the next 2 years. Now, probably most of you know I'm about as conservative as there is anybody in this building. I've tried to be over the years. But I understand there's some things in government that we have to do. And taking care of our seniors is one of those essential functions. Make no mistake, this is going to cost a pretty penny. It costs money to fund nursing homes and all that. But I think this should be one of our first priorities. We have the money to do it, and we should do it. Thank you very much. And I'd like to introduce Senator Moore.
Thank you, Senator Davis. Good morning. I'm Mary Ann Moore, and I represent Senate District 6, which is all of Washington County, as well as Goldsboro, Winter Harbor, and Sullivan in Hancock County as well. And I serve as the Senate lead in the Health and Human Services Committee. Maine cares for its seniors within what we call the continuum of care. This involves 3 levels of care, from nursing homes to assisted living facilities to in-home care. When any one of the levels of care is struggling, there is greater pressure on the other 2 levels. For example, when nursing homes are short-staffed and underfunded, families turn to assisted living facilities and in-home care. The entire continuum is the same form of funding crisis at the moment, and families have very few options to obtain the care their loved ones need. To remedy this, the Health and Human Services Committee fashioned LD 1573, combining approximately, I think it was 4 or 5 bills together into one, which basically raises the reimbursement rates for senior care workers to 125% of the minimum wage. At present, this would allow these providers to pay workers as much as $15 per hour. We have yet to see the fiscal note on the bill. That's legislative talk for the price tag. But whatever the cost of the bill, we really have no choice but to fund it and remedy years of shortages. But since the bill itself is written to take effect next January, we must also provide an additional 6 months of funding beginning July 1st so that these providers can begin rebuilding their staffs today. At this time, I'd like to introduce Senator Brad Farron, who's been focused on this issue for several months now.
Thank you, Senator Moore. My name is Brad Farron. I represent Senate District 3, which is the majority of Somerset County. Last summer, Maple Crest, a nursing home in my district, experienced 7 deaths due to the outbreak of COVID-19. At that time, I told my constituents that we would get to the bottom of this issue. And since then, it seems every time we dig a little bit deeper, we find greater and greater problems. As Senator Pouliot pointed out, well over half of the COVID-related deaths in Maine have occurred among nursing home residents. At the same time, 45% of those facilities say they are understaffed due to underfunding. We all know that the problem began back in 2017 when the state began mandating a higher minimum wage, and in just 3 years it's rose by 60%. At the same time, state government has not increased the reimbursement rate to cover that increase, leaving these facilities, at least those that didn't close, grossly underfunded. Already behind the funding 8 ball, along came the pandemic and all of its additional costs. Now we're in the midst of a crippling statewide labor shortage, further complicating the staffing problems in nursing homes. It's no mystery that in March and April, Maine led the nation in infection rates among nursing home residents. It's not surprising that nearly 60% of all COVID-related deaths in Maine were among nursing home residents. We have lost on average a nursing home resident every day of the pandemic. Last week, I received an email from a group that manages assisted living facilities, the second level on the continuum of care. Back on December 23rd, when Maine had 730 new COVID cases, DHHS notified these providers that their reimbursement rates would be cut by 5% due to a calculation error by DHHS. It would be clawing back 15 months of reimbursements. This, coupled with the challenge of COVID, then added to the growing labor shortage, has left these facilities, the middle level of the continuum, in a huge financial bind. So we know we've taken in over $3 billion, $2 billion in Federal CARES Act, $900 million in a surplus. 60% of the deaths happen in long-term care facilities, and we, the legislature and this executive, has spent less than 2% taking care of our elderly in this state. It is shameful and it's wrong. We as a legislature need to step up now and do something about it. You've heard from these folks, and I ask all of you, these are numbers that come from the Maine CDC. We don't make these numbers up. They came from the administration. It's time we stood up and took care of our family members and the elderly in this state. So with that being said, I'll turn it over to Senator Pouliot to wrap things up.
Thank you very much for being here today. I don't really have anything else to add other than we need to double down on taking care of those who are most vulnerable in this state. We have the resources to do it. I would charge each and every one of you to dig deeper into this, to report on this issue and to share the story with the people of Maine. It's important they know what's going on, and the lack of funding has become dire for these facilities across our state. So thank you for being here today. We'd be happy to answer any questions you have.
For Senator Davis, are there any discussions on the supplemental budget for putting this money in?
Pardon me?
Is there any discussions underway to put this needed money into the supplemental budget, or I suppose the Allocation Act as well?
There is some money going into it, but not the space of it, I can tell you.
But you're saying it's not enough?
That's right. We need more.
Senator Davis, have you had this discussion yet with the members of the Appropriations Committee that you're on?
We have been talking within our own caucus, yes. We haven't talked with the members.
But just within the Republican
Yes.
caucus, not with
As
the
of right
broader
now.
committee?
As of right now, yes.
And I'd ask for whomever wants to answer it, 2 questions. One, I think Senator Kimes said that this would, what's being proposed would bring starting wage up to around $15, I think.
Probably.
Is that, in this day and age, is that enough to solve this labor shortage? That would seem to be, I mean, it's less than $3 over minimum. Is that enough to get people to come and do these jobs?
I don't think so at all. My granddaughter works in the store. She's up around $20 an hour.
And we realize that that does not, it's not going to be sufficient. I'm sorry, Senator Moore, I'm just, we realize that is not enough, but we were trying to come across the board with some sort of a tool that we would be able to identify that. So that's where we came up with 125% of the minimum wage. However, we have included in there a cost of living adjustment so that we don't have to do this every single year. So we did include that in the LD 1573 to try to accommodate that. And you're right, you can go and work at Dunkin' Donuts for $15 an hour. And these are direct care workers that are taking care of our most vulnerable population. But it's a start, and that's where we've got to do. We have to do something to start with, and that's what we're doing. Didn't mean to interrupt.
The only thing I'd like to add in there is that the other side knows that this has been a priority, Don. That in our conversations, we've made it known for months now that we need to fund, nursing homes at a better rate. So this isn't news. This isn't something new. It's not something we're keeping hidden from them. It's been in our priority list that we put out on the budget. It's been Senate and House Republicans' priority from day one about getting nursing homes funded to where they were. I personally had 2 bills in, and everybody around here, like Senator Davis knows, I'm pretty conservative, and I know that they're way underfunded. And it's a serious problem that needs to be addressed in the state of Maine, and it needs to happen now.
Have you had the face-to-face talks with whether it's President Jackson or others on the Democratic side and the governor to have they indicated anything?
Yes, Don, in answer to your question, thank you for the question. But in answer to your question, in some of the meetings we've had with the governor, we told her that this is a priority for us, and she has assured us that in the supplemental budget there is some funding. But what we have seen so far, we question whether the amount that's in the supplemental budget is adequate enough to do what needs to be done in today's marketplace, in today's unemployment, the way people are, coming off unemployment. I'm not convinced it's enough money, and it doesn't start until, 90 days from now. So,
Senator Timberlake, I like this. The other piece on the administration piece, because we reached out and asked a bunch of these questions, and what we heard was that there was money in the supplemental budget as well as going forward in the next biennial budget. But there's a certain amount that has to be put in for strictly because of the 80% match that they have to do. So it's not increasing it. There's a certain amount that's mandatory that has to go on with the cost of living piece. There's been no additional funding beyond what is mandatory. And that's what we're asking for. There's got to be some of the stuff that goes beyond that, not just to keep up with that piece of it. And that's what we're asking for, is additional funding beyond what's there, the $15 million.